Hello, I'm Dr. Rick Serola, chiropractor and founder of Serola Biomechanics and the inventor of the Serola Sacroiliac Belt. I designed the Serola Belt to support the back, pelvis, and upper legs better than any other belt. And for pregnant women, the Serola Belt provides numerous benefits when worn during and after pregnancy. The Serola Belt has been used in women's clinics and hospitals worldwide in the care of pregnant and post-pregnant women since 1991. We have been clinically proven to provide significant benefits to pregnant women, and we are the only belt of any kind endorsed by the women's section of the American Physical Therapy Association. In this short video, I will explain how these benefits work. First, I will address how the Serola Belt helps during pregnancy. There is no question that the sacroiliac joints become unstable during pregnancy as the body prepares for delivery, and that support to these joints is beneficial. During pregnancy, the body releases hormones that weaken the ligaments so that the pelvis and hips will spread for delivery. Ligaments hold bones together at joints, but they are much more than that. They are regulators of muscle tone. They have nerves within them that send signals to the muscles to stabilize excess movement by contracting some muscles and inhibiting or relaxing others in an attempt to remove the stress on the ligaments. In other words, the ligaments are protecting themselves and they use the muscles to do it. For instance, with sacroiliac stress, some of the back muscles tighten, while some of the belly muscles slacken. The imbalance in these muscles leads to dysfunction, pain, and more injuries. The Serola Belt acts like an external ligament to support the sacroiliac joints. It takes the stress off the ligaments so the muscles don't have to, so they can become more balanced. The tight back muscles relax and the loose belly muscles firm up. As a result, they are stronger, have more endurance, and less pain. The Serola Belt is completely different from other belts that support the trunk, such as weightlifting belts, lumbar belts, or belly bands. All of these other belts cause muscle atrophy with prolonged use because they take the place of the trunk muscles. They do the work so the muscles don't have to, leading to weakness in the muscles and instability in the lumbar, sacroiliac, and symphysis pubis joints. You can't push a muscle into shape. Muscles must be used to remain strong and healthy. In contrast to these other belts, the Serola Belt goes low around the pelvis or hips to act like an external ligament. So it stabilizes the joints, much like how other braces work, be it the knee, wrist, elbow, or other joint. Stabilize the joint and the muscles work better. It's as simple as that. Now let's talk about how the Serola Belt helps after pregnancy. It is just as important to wear the Serola Belt after pregnancy as it is during. As you can see in this animation, during pregnancy the pelvis moves forward and down, and the alignment of the joints causes the large bones of the pelvis to move outward. This is how the pelvis spreads. The sacroiliac joints are pivot points, so even though they themselves move very little, this small movement at the sacroiliac joints creates a significant widening at the hips. Also, the forward tilt of the pelvis makes it look wider than it would in an upright posture. As we pointed out before, the Serola Belt holds the pelvis stable during pregnancy to minimize the spread. However, after delivery, it helps to pull the pelvis back toward normal alignment, narrowing the hips and improving posture. The body has a natural ability to reverse some of this widening, so the hips will narrow somewhat even if you do nothing. We know that exercise to the abdominal muscles is beneficial and significantly helps narrow the hips after delivery. As the muscles work, they increase tone and shorten and pull the pelvis back into proper alignment. This is a key concept in understanding how the Serola Belt helps to reduce hip size after pregnancy and why it is much more effective than belly bands or lumbar belts. Belly bands and lumbar belts compress the abdomen from the outside in an attempt to replicate the effect achieved through tightening the muscles by exercise. Unfortunately, it's not the same thing as tightening from the inside. In fact, it's just the opposite. Supporting the muscles allows the muscles to become flaccid and, in the end, may not help at all. You can't push a muscle into shape. On the other hand, by stabilizing the pelvis, the Serola Belt takes the pressure off the sacroiliac and symphysis pubis ligaments, so the muscles can work normally. Therefore, the inhibited belly muscles increase tone and firm up to both help support the baby during pregnancy and help shrink the hips after delivery. As I mentioned earlier, exercise makes sense and wearing a Serola Belt makes sense. A Serola Belt even helps make exercise more effective. But even when you're not exercising, wearing the Serola Belt will help tone your muscles and narrow your hips just during normal daily activities. Also, because wide belts may compress the tops of the pelvis, they can cause flaring at the bottom of the sacroiliac joints and cause some stress to the ligaments, to which the body responds by weakening the muscles even further. This is why the Serola Belt is narrow, to fit into the shape of the pelvis at the sacroiliac joint. So do yourself a favor and get a Serola Belt for both during and after pregnancy. Your body will thank you.